Good afternoon. Today is Tuesday, May 4th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me are Teresa Woolson, Administrative Coordinator with the Operation Oswego County, and Diane Oldenburg, Senior Public Health Educator for the County Health Department. The COVID-19 pandemic has affected us in many ways. One being that reliable access to broadband internet is no longer a luxury. In the past year, as more residents went online for work and school, we discovered the need for better, more reliable, and more affordable broadband service. To help address this issue, we have partnered with the Central New York Regional Planning and Development Board to conduct a study that will assess our broadband capabilities. ECC Technologies has created a website and a survey to help identify issues with internet access, service, and cost. I encourage all residents and business owners to complete this survey. It takes just 5 minutes, and your answers will help determine where online access is the most critical and what other issues need to be addressed so we can improve the broadband experience here in Oswego County. Go to cnyinternet.com for more information and to answer the survey. You can also find CNY Broadband Internet Study on Facebook for details. If you don't have access to the internet, call 315-412-5966 to request a survey. COVID-19 reports have unfortunately taken a step back this week. Our 7-day positivity rate jumped from 1.4% last week to 2.3% this week. Our community transmission rate remains high, according to the CDC. We understand that this is frustrating for all of us, but we must not let it deter us from our goal of overcoming COVID-19 and ending this pandemic. The best way to do this is through vaccinations. The more residents we can get vaccinated, the more we can reduce the number of new positive cases, and the sooner we can get back to normal. If you are eligible to receive the vaccine, please make an appointment today to get vaccinated. The COVID-19 vaccine will protect you from the virus, from experiencing severe symptoms or being hospitalized. It will protect your family and loved ones in the same way. The Health Department is hosting 2 more mini clinics at its office on Bunner Street in Oswego. The first is scheduled for tomorrow, May 5th, from 3 to 3:30, and the second is scheduled on Monday, May 10th, from 3:30 to 4:30 p.m. The Moderna vaccine will be administered at the first clinic, so participants must plan on returning on June 2nd for their second dose. The Johnson & Johnson vaccine, which only requires 1 dose, will be administered at the second clinic. For more information about all 3 COVID-19 vaccines, click on the fact sheet link for each one at covid19vaccine.health.newyork.gov. The links to register for these clinics are posted on the Health Department's COVID-19 vaccine page. You can also call the Oswego County COVID-19 hotline from 8:30 a.m. to 4 p.m. weekdays to make an appointment. Dial 315-349-3330. The challenges we faced this last year with the pandemic have been stressful for both adults and children. The protocols we've been following to reduce the spread of the virus, actions such as social distancing and avoiding gatherings, have made many people feel isolated and alone, increasing their stress. May, being National Mental Health Awareness Month, is a timely opportunity to help others cope, practice self-care, and take the most important step of reducing the stigma of mental health that so often prevents people from asking for help. Today, Teresa is here to give us more information about mental health care.
Thank you, Chairman Weatherup. May is National Mental Health Awareness Month. According to the National Institute of Mental Health, nearly 1 in 5 U.S. adults live with a mental illness. In 2019, there were an estimated 51.5 million adults age 18 or older in the United States with any mental illness, or known as AMI. This number represented 20.6% of all U.S. adults. Young adults ages 18 to 25 years had the highest prevalence of AMI, 29.4%. compared to adults aged 26 to 49 years at 25.0%, and age 50 and older 14.1%. In 2019, there were an estimated 13.1 million adults age 18 or older in the United States with a serious mental illness, or SMI. This number represented 5.2% of all U.S. adults. Young adults aged 18 to 25 years had the highest prevalence of SMI, 8.6%, compared to adults aged 26 to 49 years at 6.8%, and age 50 and older, 2.9%. And only 43% of those struggling receive treatment for these conditions. And only 51% of youth, aged 6 to 17, receive treatment for their mental health conditions. Among the biggest reason for so few seeking out treatment is the fear and shame caused by stigma. It is the mission of the Oswego County Suicide Prevention Coalition to bring an end to the stigma and to help build a community where people will be free to comfortably talk about their struggles without fear of judgment, ridicule, or backlash. Every person has mental health and should be doing things to maintain good mental health, just as you would take measures to maintain good physical health. This month, let's work on normalizing conversations about our mental health. If you or someone you know is struggling with their mental health or thoughts of suicide, please call the Suicide Prevention Lifeline at 1-800-273-8255, TALK, or text HOME, HOME, to 741-741. Liberty Resources Mobile Crisis is also available in Oswego County for both children and adults in crisis. The number to contact for assistance is 315-251-0800. And now I'll turn it over to Diane for the latest reports from the Health Department. Thank you.
Thank you, Teresa. As of today, 42.1%, or 49,622 Oswego County residents have received at least one dose of vaccine. 40,781 residents have completed the vaccine series. In the 65 and over age group, our vaccination rate is 75.8%. That is higher than the state's rate of 74% for that age group. Although these numbers indicate progress we've made, we need to get more people vaccinated to reach herd immunity. While vaccines are some of the best tools we have to safeguard public health, they won't protect us if we don't get them. If you're eligible for vaccine, please make an appointment and get vaccinated as soon as you can. There are many places that now offer vaccine, including Oswego Health, Connects Care, and several local pharmacies. As of this afternoon, we have a total active positive cases of 167. We've received a total of 203,924 test results. Cumulative positive cases, 7,764. Total negative results, 193,578. Total patients released from isolation, 7,507. We have 90 deaths related to COVID-19 as reported by the New York State Department of Health. And we currently have 525 residents in mandatory quarantine or isolation. Regardless of your vaccination status, please be proactive and responsible about preventing the spread of the virus. Remember the 3 W's. Wear a mask, watch your distance, and wash your hands frequently. Thank you.
Thank you, Diane. The United States Small Business Administration began accepting applications for the Federal Restaurant Revitalization Fund yesterday. The program provides direct relief funds to restaurants and other hard-hit businesses that have experienced significant losses due to the pandemic. Online applications will continue to be accepted until all funds are exhausted. The County Solid Waste Department announced the 2021 opening of its household hazardous waste facility last Saturday. Residents can safely dispose of cleaners, pesticides, and automotive products. It will be open from 8 a.m. to 2 p.m. on Wednesdays and from 8 to 11 a.m. on Saturdays until September 29th. And don't forget that the New York State burn ban remains in effect through May 14th. There is more information about these programs on the county government website at oswegocounty.com, along with the latest information on COVID-19 clinics and testing. I encourage you to check back frequently as things continue to open up. Let's work together to improve internet access, vaccination rates, and mental health support. Thank you for your cooperation and help in keeping our communities safe.